And to come now to the issue around health and around preventative health, even for visitors, I don't think it's terribly hard here to notice the prevailing debate about hospitals and health reform in Australia. It's all about beds, it's about elective surgery, it's about hospital treatment. Yet, as the Prime Minister has said, it's crazy that only 2% of our health spending goes to prevention. But unfortunately, the political reality is that there is no waiting list for prevention, nor for that matter is there a waiting list equivalent for parks. So this is, in a sense, why we have to fight for space and fight for, in a sense, for the notion of promoting our health, of preventing sickness and ill health is something that is not politically easy to do. It's often involved in things that are difficult for politicians necessarily to get community support for, and that's why we have to, I guess, fight much harder for it. Gus mentioned before that I'd been chairing the National Preventative Health Task Force, and our job, in a sense, was to set out what Australia should be doing over the next 10 years to prevent illness and premature death caused by obesity, tobacco and the harmful use of alcohol. We delivered the National Preventative Health Strategy 9 months ago, and I'd just like to mention a few of the parts that relate to the themes of the Congress. And they're the increasing levels of physical activity and reducing sedentary behaviour, embedding physical activity and healthy eating in everyday life, and the development of the planned Australian National Preventative Health Agency. We've recommended the development of a new Prime Minister's Active Living Council to lead major reforms, for example, changing our urban design to maximise activity, whether this is around Australian and state government legislation, building codes, planning guidelines. There are now so many great examples through non-government organisations, through great local government initiatives, where we know how to do good urban design. It's a matter of taking these to scale across Australia. This also includes adopting and expanding programs like Travel Smart, a national cycling strategy, a national pedestrian strategy, and expanding active recreation, and this is really where parks come into play, and sports at the community level, where this really does promote not only physical activity but promotes social engagement in active living and in sport. We feel that we have to embed physical activity and healthy eating, for example, in everyday life, in schools, communities and in workplaces. One of the starting points is actually happening today, we hope, with the ministers all meeting from around Australia, by incorporating health and physical education for all children into the second stage of national curriculum development. In a sense, if we don't make it a priority in our schools, we can't make it a priority in our lives. We have to monitor a requirement for at least 2 hours of physical activity a week, per week for students, and expand coverage of really great out-of-school care programs such as Active After School and Eat Smart and Play Smart. In communities, we still don't know actually what to do in terms of how to really manage and prevent overweight and obesity. And that's why we have to fund and carry out a series of national comprehensive 5-year prevention intervention trials in at least 12 communities, we think, that do include low socioeconomic groups and Indigenous communities. We need to build this evidence base to find out what actually does work in obesity prevention at the community level. And lastly, in Australia's workplaces, which we think is the new frontier for prevention. Now there are an increasing number of companies that are actually interested in health promotion in their workplaces. The Victorian State Government's actually done a very good job in a new program called Work Health, and bringing this together now with more providers that are actually interested in this. Insurance companies are now interested, health insurance companies and the insurance companies, because they know it's good. They know that the healthier workers actually produce more, and they obviously cost less in terms of overall insurance payouts. And lastly, the planned Australian National Preventative Health Agency. This is to get the 3 levels of government, industry, major NGOs and researchers together. It's building our collective evidence base and our collective experience base in these particular areas. 2 more things. One, I'd like to focus on just one aspect of urban design. A couple of years ago, I had the fascinating experience of chairing the first 5-year review of Melbourne's planning blueprint, which is called Melbourne 2030. And what was fascinating in this is that you cannot avoid the fact that if people in particular want to age in place or to stay where they are, then we will need increased urban density. There are huge numbers of places actually in a city like Melbourne where this can actually happen. And at the same time we have to maintain the green canopy, and I don't think we actually focused enough on that in this review. But interestingly enough, a city like Melbourne has really only two levels. It has this very high level in inner city, and then it's sort of flat. And it's this building this middle level, whether that's say 4 to 6 stories, where we can actually increase urban density, allow less of an impact overall on our environment, and at the same time give, if designed well, give access to new green spaces by virtue of good urban design. Again, we can learn some terrific lessons from wonderful cities in Europe where you do have the sense of middle-level apartment buildings that do give access onto green spaces as well. So in fact, in many ways, people can have more access to green spaces that they might not otherwise have. But in a sense, it's being creative about how we can both have enough urban density to survive in cities well, but at the same time increase the green spaces. Last, I recently wrote an article for a parenting publication, and it said that finding your own special place, whether it's in a neighbourhood or on a beach or on top of a mountain or gliding down a river, and sharing that with your children is certainly one of the great gifts of parenthood. And maybe just turning 1 hour a week away from TV viewing, where we are all being bombarded with junk food and drink advertising amongst many other things, and turning that into active pastime outdoors, and if it is in a park, it is, in my view, wonderful, wonderful, wonderful parenting. Parks do represent a wonderful opportunity for safeguarding and promoting our own individual physical and mental health. But as importantly, they are also so important for the physical and emotional health of our families, of our neighbourhoods, our nations, and of our globe. Thank you very much.